Hi again. Thank you for choosing In My Shoes. I'm your host, Hilda Broady. A couple of things I'd like to get clarified. We are broadcast all over the world at www.bronxnet.org. And we're very, very happy to present the new and exciting show called In My Shoes. I have had several problems with the police department with regard to ticketing, and I'm just going to give you a little update on that. I've gotten another ticket, so we're now up to 57 and counting, and I guess it will go on until I'm very old and very gray. Anyway, without further ado, I would like to introduce my special guest, Mr. Korie McCullough. Today we're going to be discussing the changes in the healthcare systems, because the show is called In My Shoes, from the time when I had difficulty with healthcare until the present day. And I thought, since he is a participant of the new healthcare system, the Affordable Care Act system that they're calling Obamacare, and I'm, I guess, an alumnus of the Medicaid system, and presently with Medicare, I thought we'd like to bring that up and see how many people have also had some challenges with the healthcare system. I can't say that I can't fault it all the way, but it is quite challenging to us. So without further ado, I don't really discuss my guests with you as you've seen the show, so you can tell the audience a little bit about yourself and what's up.
All right, well, thanks for having me on the show. My name is Korie McCullough. I'm a bus driver. Been a city bus driver not a city bus driver, but a tour bus driver in the city of Manhattan for the last 2 years. I'm also a certified transmission technician, have been for the last 2 years. It's basically a little about myself. That's what I do. Drive a bus in Manhattan and drive tourists every day to certain landmarks and certain stops. That's pretty much what I do.
Find that exciting?
I find it very exciting. It could be sometimes very demanding, very, how would you say, challenging at some points in time. Yeah, but other than that, it's a nice job. It's a good job. I wouldn't argue about it.
Okay. So I mean, I don't know if I could do that, but I don't have the patience to drive people around on a regular basis.
Right.
In Manhattan.
Right.
In Manhattan traffic, so that would be difficult. But we came to talk about. I think I should give a little background on when I was a freshman in college. I was an emancipated minor.
Right.
And so I thought that, and I was homeless, so I thought that maybe I should have some health insurance.
Right.
Back in the olden days. Okay, and so they said, well, go to Medicaid.
Right.
So I said, okay, I went to Medicaid on 33rd Street, and I filled out the application and everything, and believe it or not, they said I was too poor.
Wow.
Now, you know that life is really, really traumatic when somebody tells you too poor for the poor man's medical insurance.
Wow.
So, I mean, they said, well, go over to public assistance, go over to welfare. So I went over to welfare and I applied for welfare because they said, well, you're too poor for Medicaid, but if you have welfare, you automatically get Medicaid. So I said, okay. Now, remind you, I'm a freshman in college and I'm homeless.
Right.
I live in a dorm, so that's where I'm going to be. And, okay, so here's my, I applied for public assistance, and they have an interview. This is the most traumatic kind of thing that somebody can go through when you go to welfare to get assistance, because they make you feel like doo-doo, first of all.
Right.
Okay, but what they did was they said, well, you look healthy. And I said, because I am. And they said, well, do you use drugs? And I said, no. Well, do you drink? And I said, no. And they said, well, do you have children? And I said, no. Well, are you pregnant? And I said, no. So I'm answering no to all the questions, and they're saying, well, then you should go get a job. So I said, but I'm a freshman in college, and we've been advised that we can't or should not work our freshman year, that we needed to focus on our classes. So all I want is Medicaid. I don't even want your money.
Right.
And they said no. They gave me my no right back. So I went back to the school and I talked to the bursar there and I said, have you ever heard anybody being too poor for Medicaid? And she was like, and I said, yeah, too poor for Medicaid. That's kind of embarrassing. And she said, well, what do you have to do? I said, well, I'm gonna have to fix this. So I had to get my financial aid letter and make it appear that I was getting more than I was getting, so that I would meet the poverty line, I guess. I don't even know what they were going on. Meet the line where you have to have some kind of income or something in order to be eligible for Medicaid. And all I wanted was medical insurance in case I got sick while I was in school.
Right.
That was my experience with Medicaid in 1971.
Right.
72. Because it was the second semester of my freshman year. So now, you had Medicaid as well, I heard.
Right.
And
Right, I had Medicaid. Medicaid, I mean, it was fine. It was great. I mean, I took care of everything that I needed to take care of, and as far as the services was fairly decent and very nice, and I never had a problem with it. But I eventually ended up making a little too much more than I was supposed to make, and able to have Medicaid. So the new law when it came into act, I was told that you would have to have insurance. If you didn't have insurance, you would have a penalty. You'll have a penalty for that year when you signed for, I think it was for when you filed your taxes for the next year, you will have a penalty of either $200 to $300 for that year if you didn't have insurance. You're required by law to have the insurance. So I applied for insurance. I applied for the health coverage, the new law that went into act. Applied on health. I think it was NewYork.gov. NewYork.gov. They have a website, health plan. I went to them, and they had a marketplace full of insurance companies that, that had which policies was affordable, which one you can afford or not, and it was fairly simple. And I found one that suited me, that I thought suited me at the time, and come to find out that you have to pay the deductible. Deductible at the time with this company is $1,700. I spent $174 a month.
plus the 17. Wait a minute. You pay $174 a month,
$174 a month.
and you have to meet a $1,700 deductible.
That was paying into the deductible.
The 170.
$74. I thought I was paying. When you pay for insurance, you usually think that you're paying for the policy itself. You're actually paying into the deductible. And until the deductible is paid down, that's when, in a sense, I came to this conclusion, thinking that maybe, assuming that if everything was paid, you would have to pay the deductible down in order to use the insurance. Because while I was using it, thinking that I had coverage, I was going to my doctors as usual. I have sleep apnea. So I was going to my sleep apnea doctor to get it treated, and after a few visits, he's telling me, okay, you owe us $1,000. And I said, so how do I owe you $1,000 when I pay insurance? So I called my insurance company, and I said, I got an issue with one of my doctors is saying that he hasn't been paid, and I've been paying you $174 a month. I've been paying you the policy. Well, what was explained to me was saying that until the deductible is paid, until the deductible is paid down, that's when we'll start paying the doctor bills that you incurred.
Okay, so you had to pay your doctor $1,000, plus you have to pay the $174, and altogether it's going to be counted toward the deductible. Is that the $1,000 that you paid your doctor?
Well, I haven't. He hasn't sent me a bill yet.
Okay, but that $1,000 is going to count towards your deductible, or I don't understand that.
Well, the $1,700, the deductible, until the deductible is paid off. Until the deductible is paid off, you wouldn't be covered.
Okay, so but the deductible is like when I have Medicare now, and I have to pay. Well, they changed it now, so I'm not quite sure what I have to pay. But I had to pay a certain amount to go the copay.
Right.
Okay, and then I have a deductible as well.
Right.
Okay, so you have a copay when you go to your doctor, right? You have to
Right.
pay
I have
them.
a copay. I have a copay of $50 for a specialist, and for my regular doctor it's $30.
Okay.
But as far as the policy is concerned, is you stay on, like I've been had it for almost a year now, so the deductible is paid up, so everything should be covered now.
No, because now it's a new year. Don't they start over every year?
No, it doesn't start over every year. It's just if you stay with the same company, and you have the same policy, the deductible would be paid down. And once the deductible is paid down, then you're covered. You're covered then. But my premium just went up $24
A month.
$24 a month. So now it's $198 a month. So
And that's affordable care.
that's supposed to be affordable care.
Okay. So you'll be cashing in some bottles, huh? No,
Right.
no, let me stop. That was mean, okay?
But it's been a process with the insurance because I went to my regular doctor, and usually when I had Medicaid, I didn't have a problem with him. I go to him, and I basically get my checkup, and then I would go to, and wouldn't have no problems going to him. But now since I've been using this insurance that I have, the company that I have, it's been, I owe him $50 now. I owe him $50 now.
Your primary care
My
doctor.
primary care doctor, and I never had that problem before. So the biggest thing was if it was explained from the beginning to give you somewhat of an idea of how to go about getting the insurance, or who to deal with, or how to deal with the policy itself, I wouldn't have had to ran into all these problems that I had with the insurance that I have now. Another situation that I'm having now is that I'm thinking about relocating, and I can't carry it with me.
Excuse me?
I can't carry the insurance with me. It's only based in New York State, so I can't take it with me. So one of the issues that I'm running into now is I'm thinking, okay, what happens is if I decide to leave, I relocate, and I try to apply for it. Do I have to start all over? Does the will have to start all over again, or what do I do now?
So can you contact your insurance company and say, can you transfer? Do they have, wherever you're going, do they have an affiliate in that state or that city? Do they may have an affiliate and you can transfer, or are you satisfied with that coverage so that you could say, I want to stay with them, but I'm going to be in a different state? Or
Well, I had a discussion. I talked to him over the phone, and I asked him, I said, so I'm thinking about relocating. And the first question I did ask him, I said, could I relocate? Can I still use the same insurance that I have? He says, well, for a while until you switch over, I would have to find another insurance company because they don't have any affiliates in the state that I'm looking for.
oh boy.
Right. So I'm hoping not to have to start the wheel back over again. But I'm gonna keep looking. Hopefully, maybe I can resolve this issue or whatever the case may be at the time. But it's very trying with this insurance because nobody says it. It's not explained. It's not explained.
And who do you call? Because I mean, some people say, "Well, I don't even know what to do. I don't even know what to do."
Right.
So they're not getting it. They're not applying for anything. They're not covered. They're going to pay the penalties because they don't know what to do.
Right.
And they're asking me, and I'm telling them, I don't know what to tell you. So I haven't found a central location. Like usually I can find and get information and
Right.
pass it on.
Right.
But there's been no comprehensive information available on this health insurance. I know that it's necessary. I know that we need it, but we also need to understand it.
Right.
Okay.
Right. It needs to be explained. I mean, you can't reason. You know how it was in my parents' days and your parents' days. You be able to reach somebody on the phone, have a conversation with them.
Not really. With
I mean, not really. I mean, maybe not. But I'm saying, as far as it needs to be somebody there that you can call and reach to, because instead of dealing with the websites and calling on the phone and getting an automated voice message,
Exactly.
because it's not, you need to talk to somebody. It's like, what do I need to do? How do I need to go about getting coverage for myself?
Maybe there should be like an office that's open. Not even saying open 5 days a week, but twice a week or
Right.
various hours,
Right.
sometimes in the morning, sometimes in the evening, to take care of the people because the people who are getting this insurance work.
Right.
So you can't be open from Monday to Friday, 9 to 5 or 10 to 4 if people are at work, because then they have to miss work to get information, and that's kind of counterproductive.
Right.
Because then their income is diminished because they haven't been to work.
Right. Right. And the only other option is, if your job has the insurance, is my job's insurance is through Cobra, and it's 200. I think it was 220 a person, plus dental is $60. So I would have been spending $280 a month.
What kind of coverage was it though?
I mean, it was coverage for health. It was for health, and you had to pay extra for the dental. But the coverage that I had, that I thought would have suited me very well, was $174 at the time. So you start thinking this price range, you start weighing your options. Okay, well, why get that when I can get this for $174 a month and have dental coverage? But you don't understand the backslide of the onslaught of stuff that's coming, saying, okay, well, you got to pay the deductible, because I went to my optometrist. I'm not saying it right. Obstetricianist.
No, that's the pregnant guy. Wait a minute. Optometrist, maybe.
Optometrist. That's what I meant to say.
Optician.
But I went to him, and they wouldn't even touch it. They wouldn't even touch it. They looked at no.
They were afraid to deal with
because
the system.
they didn't know how to go about dealing with it. I mean, it's a lot of the issue is a lot of people not knowing how to deal with it. Like he said, he had a customer came in there with the same insurance that I had, and they couldn't figure out how she was going to pay, or who was paying, or was the insurance paying, or was she paying. But she ended up getting free glasses, and they ended up getting the short end of the stick.
Oh.
So that's the reason why they were so apprehensive of taking my insurance. So that made it, so now they have a system where that they made a phone call and said, okay, well, you got to pay $314 on the deductible in order for us to see you.
In addition to the $1,000?
No, that's part of the deductible. That's what I had left on the deductible at the time.
Okay.
$314. It should be paid off now. So I should be able to get my glasses, hopefully. But I mean, it hasn't been easy, and it is not explained. It's not explained. It needs to be explained to people. Okay, this is how you need to go about getting the insurance. This is what's going to happen. And if you don't get this, if you don't get coverage, this is what you're gonna have to do. Like I was supposed to go to a H&R meeting, a H&R Block meeting about how would it tie, like getting this new health insurance, how does it tie to your taxes?
Well, it's because you're paying $170 something a month. That should be tax deductible.
Right.
It's your health insurance is tax deductible. Your union dues are tax deductible. Your uniforms are tax deductible. These are things that are tax deductible, so that you're not penalized twice.
Right.
That's what it is, because you're paying income tax
Right.
already. So
Right.
So and then if the government is saying that now you better have some health insurance, so now you're paying that as well.
Right.
So they shouldn't tax you. That's like double taxing you. So you should be able to deduct your health insurance from your income tax. It should be a credit.
Right. I mean, it's just as far as, I know that the government, the way it's a subsidy. The way it's paid is like the government pays $200 of my policy, and I pay the rest of the policy. So it was actually for me paying $174. The government is paying $200 a month, and how I applied it's just like how you apply for Medicaid. How much money you make? Yeah, I actually made an extra $3,000 more than what I thought I was going to make because I couldn't gauge it because the job that I have, it's not. How would you say it's not really stable. It's really part-time work. So during the summertime, I can pick up, extra days instead of during the winter, like when it gets really slow. So I don't know how much money, I couldn't predict how much money I was gonna make for that year, which I ended up making $3,000 more.
But you had to estimate.
Right. So assuming that would there be a penalty for even making more than what I was supposed to make? Because that's what I said to them. But at the same time, I'm paying them income tax plus I'm paying for the health insurance.
They may recalculate.
Right.
They may recalculate. Who knows? But I don't think they can penalize you for not knowing what you're gonna make if you have a job where sometimes you're working and sometimes you're not working, so you're not sure. So it's not like I was a state employee. I knew that every year I was gonna make this amount of money.
Right.
Okay. But at least, with that, I had wonderful health insurance when I was working.
Right.
And then I became retired. And I'm Medicare eligible. And it is the worst system that I've ever experienced, even with being told I was too poor for Medicaid.
Right.
Medicare, how do I say this now, sucks. It really and truly is not. If you have good health insurance and Medicare becomes your primary,
Right.
then your insurance that you had dummies down to what Medicare is.
Right.
So whereas I had coverage that covered certain things when I was working, I no longer have that coverage. I no longer have vision. I no longer have dental. I have tags on my. They don't take the tags off unless I pay to take the tags off now.
Wow.
It's things that my insurance covered, Medicare does not cover, and everybody says that they're gonna take the Medicare, but then you have all of these other costs.
Right.
And
Right.
then you're not, even with the Medicare D, which is for your prescriptions.
Right.
Okay. I got a prescription from the doctor recently, and she said, "Oh well, you can get a discount if you use this card." And she gave me the card. She just called them and take it to the pharmacy, and the pharmacy said, "Well, no, you can't use this card. You get $75 off, but you can't use this card."
Wow.
So I said, "Excuse me?"
Wow.
And she said, "No, call them." So I called them and I said, "Excuse me, I'm trying to register this card." And they said, "You have Medicare." And I said, "Yes, I do. You're not eligible." I said, "But Medicare doesn't cover my prescription." And they said, "Sorry."
Wow.
So my prescription is $200 and something, and I can't get the discount because I have Medicare.
Wow. That's a big issue. That's a big issue with a lot of seniors now, where they having to make life decisions between either pay. I'm either gonna get my meds that I need to live, or I'm not gonna eat. So how you expect for people to live? And we paid into a system.
It's our system.
We paid into the system, and it's not working for us.
Unfortunately, it works. It's less difficult for people who haven't paid into the system.
Right, I noticed that. I've noticed that.
If you poor, you very much. If you apply for everything, you can get everything.
Right.
Okay, I'm gonna tell you about Miss Hazel. Miss Hazel was my mother's home attendant.
Right.
Okay, this woman, God blessed her, is 80 years old. I started last year, no, 2013, trying to help her get her Medicare.
Right.
She's still working. She's being penalized because she's still working. Okay, because her Social Security, because she's eligible, she can make as much as she wants to make
Right.
and get her Social Security and so get her Social Security untouched. She's only working 2 days a week, but those 2 days a week knock her over the Medicaid limit.
Wow.
So she's getting Medicare, and she's got this deductible to pay, and she's going, I don't understand this. What's going on here? And let's talk about Social Security office. She lives in Queens, so I go to Jamaica and I take her to the Jamaica office where it is challenging. Like, I'm gonna keep using that word because it's so much nicer than the things I want to say. Okay, so it's challenging. You go and you have to wait online. I mean, I'm talking about one of them ziggity-zaggity line things.
Right.
To get through the metal detector.
Wow.
To go upstairs to take a number. Sometimes you gotta wait online to get a number too.
Wow.
To sit down and you just want to ask a question. You can't say go up to the guard and say or to, cause you no get a number over there, and then you have a seat and you wait. Okay, we did this a couple of times. I went, I took her, we wait. And then we get there and they give us papers and they say, you take this to your union and let your union fill this out. I said, okay, and we take it over. I said, okay, Miss Hazel, I'm going to bring you back over here. We got all the paperwork done. Got all the paperwork done? Yes, got all the paperwork done. Because she's like Johnny on the spot.
Right.
Okay. We come back, same thing, long line upstairs, sit down. And we're looking at the numbers that never go down for some reason. They got 3 sets of numbers, got just different things happening. And we see there, and they say the paper's filled out wrong.
Oh, wow.
That's after 3 hours. Okay, so they give us the papers again. I said, so what does she have to do so that they're filled out correctly? Mm-hmm. And she said she has to take it to her union. Well, we did that. And they have to fill out this part and fill out this part because she's still working. But her job had said, because she wasn't working over 20 hours a week,
Right.
she wasn't eligible for the health insurance on her job anymore.
Oh, okay.
Okay, so we went back. We did it again. And we went back there, and they said, the papers are not filled out right. And that's when I lost my mind. But they have signs around that say if you say not nice things in the Social Security office or any federal office or anything, you can be arrested.
Wow.
So I couldn't go bananas.
Right.
I couldn't go Brooklyn on them.
Right.
So I said, okay, Miss Hazel, I'm going to take you to New Rochelle because I can't deal with these people anymore. I want to say not nice things. I want to hurt people and things is what I said.
Right.
But we're not going to do that. I said, so I'm going to pick you up. Okay, so I said, just give me 2 days so that I could calm down. I took her up to I live in the Bronx. I took her from the Bronx. I went to the Bronx to Queens, picked her up, and took her to New Rochelle. And I said, okay, now, there was no parking right out front. And she's 80. I'm not going to make her walk, too. So I said, listen, you go in and get a number. There's no lines. Just go in and get a number, and I'm going to go get a place to park my car, and I'll be there. Okay, so I found a spot like up the block, and it wasn't that far. So I came back, and she's smiling at me, and she said, I didn't have to take off my shoes. So I looked at her. No, she said, and I just went there, and I have a number. And I said, yeah, okay. And I said, and before I come out of the bathroom, they're going to have called that number.
Right.
So she said, and she's looking at me like, well, why is that? And I said, because we're not in Jamaica. So she said, are we still in New York? So I said, yes, we're in Westchester County now. But it's a different situation.
Right.
They don't have as many people. It's not a federal building. They're standalone. Okay, fine. So, and true enough, as soon as I came out the ladies' room, they called her number. Okay, and we had all the papers that we had with us from Queens, and we gave them to the lady. And she said, these papers are not filled out correctly.
Right.
The hair on the back of my neck stood up. And I was like, no, this is not really happening. But she called somebody from the back And the lady came up and she said, let me call these people and find out what's up, which nobody ever did in Jamaica.
Right.
So she called, and she didn't like the answer that she got because you could see her saying, well, I don't, and she hung up the phone and she said, come in here, we're going to get this straight today.
Right.
And I was like, I love her. I love her. Okay, so she called around and she said, these are the things that you need to do. You're not working. This is the paperwork you have to fill out. Fill out this line, fill out this line, have them fill out this line. Fine, okay? And then when you have that done, you come back here. So I said, okay, I could do this. We could do this because we know exactly what she wants now.
Right.
Okay? Unfortunately, I took her to the union place this time. I didn't let her go on her own. I said, the Social Security says you have to fill out this, and this.
Right.
Okay? And the lady filled it out, this, and this. And we went back to the Social Security office, and they still said it was wrong. So I said, okay, how we going to do this? Because I'm not going to keep trekking back and forth. I said, you know, the toll is not cheap going back and forth to Queens.
Right, and gas.
You know, but the toll was, yeah, I said, it's not like, I mean, I'm going there, and then I'm coming back, and then I'm going back, and then this is $30 in toll.
Right.
Okay, so the guy was nice. So, I mean, they're very nice in New Rochelle, and I'm going to keep giving New Rochelle accolades. I said, is there a way that you can fax over the papers that's not done correctly to the union, and then they could fax the answer back because it was like one line.
Right.
If we had known, we could have filled it in ourselves, but that would have been crooked. So he says, oh, no, you can do it. He said, unfortunately, I can't wait for them to fill out the paperwork. He said, but you can go out and get another number, and when your paperwork comes in, we'll take care of it. We did that. It still took less time to do that than to go back to Jamaica and let them tell us the paperwork is not filled out correctly.
Right.
Then we find out the reason that she's been having all the difficulty, which nobody ever said, is you have to apply for Medicare when you become Medicare eligible.
Right.
So when she turned 65, she wasn't here. She was in Jamaica.
Right.
Okay, so she got back here 5 months after she turned 65. She didn't know.
Right.
So therefore, she now is paying a penalty on her Medicare because she didn't know, and she has the deductible.
Wow.
So she went to the doctor and they sent her a bill, and she was like, "No, because I have Medicare."
I mean that would be the. I think that would be the assumption. Yes, if I had Medicare, yeah, should have been paid. But
no. And she's, because of those 2 days a week that she's working, because the last time we went, she told me she wasn't working anymore. So I said, oh, well, you know that New York State has a program for seniors. If your income is at a certain level, they will not only provide you with Medicare, but they will pay your Medicaid. They will also pay for your Medicare premium. And I was going, oh, you 80 years old.
Right.
You a senior citizen. So you can get all of this paid for, except that those 2 days that she's working knocks her over the limit by $24.
Wow.
So I'm saying, Miss Hazel, please stop working. I love you, but you have to stop working. And she's going, I have to work. If I don't work, I'm going to die. Now, what do you do with somebody who's got to go to work, and she's working Saturdays and Sundays? Mm-hmm. Okay. But she has something to look forward to. And I said, well, go to the senior citizen center. She said, they gamble. So I'm looking at her like, huh, what do you mean? They go to the casino. There's a casino out there in Queens someplace. Right. And they go to the casino. And I said, but they don't only go to the casino. She said, even if they're not at the casino, they doing the bingo. Or they doing, no, I don't do that.
Right.
So I said, well, isn't there something in your church that could happen? And she said, no, I don't want to do that. I want to work. If I don't work, I'm going to die.
I mean, well, that's a fear for a lot of older people, the senior citizen. Let me not say older people.
We old.
Let me say the senior citizens. It's a big number of people out there. I have a tour guide that works with me. He's 93 years old, and he works winters and summers, and he works 12 hours a day, nonstop. Wow. I mean, he's literally afraid, the day that he stops working, the next day he's gonna drop dead. That's what he keeps telling me all the time.
A lot of people truly believe that, though.
Right.
Which is why I wanted to make sure her health insurance was on point,
Right.
so that
So she didn't have to worry. Right. But I mean, the biggest thing, I mean, everybody is worried. You know, older people. I mean, they if they don't have they feel like if they retire, they don't have a purpose. They have nothing to do. It's just something just boring. Like, well, I don't. For you, you retired and you always manage to fill your day in every day.
You have to plan your retirement. A lot of people just stopped working because they couldn't take it anymore.
Right.
Okay, I stopped working because I didn't want to take it anymore, and I had an option.
Right.
But I planned what I was going to do when I retired. See,
Right.
and then that was the thing. I could see myself staying on for a day or two.
Right.
But if I'm in the house for a week, I'm crawling the walls and I want to hurt things. So I just find out other things to do.
Right.
You know, and that we were going to do a show about just alternatives to sitting in the house.
Right.
And things to do. Because I wanted to set up a company and just take a bus and just go get the senior citizens and don't take them to the casinos.
Right.
Take them to the museums. Take them to places around the city that people don't usually go to.
Right.
You know, and they wouldn't think to go there, but it would be something that they would enjoy because it's part of history.
Right.
You know, like.
I mean, being in New York, yes. I mean being a tour bus driver. I mean, doing the Uptown loop. You have Museum Mile, and it's just you have the Metropolitan. You have the Natural Museum of History. I mean, maybe I'm saying that wrong.
Museum of Natural History.
Yes, I was saying that wrong. But you have the Guggenheim. You have the New York City Museum itself on Fifth Avenue. You have it's a number of places for a lot of, and some of the places are for free. On the weekends they for free. Saturday the Guggenheim is for free on Saturday. I believe on Saturday, yes, and the Metropolitan is open on Saturday too for free. You know, they have a suggested. They have a suggested,
and I've heard that you don't have to pay to suggest it because
right, you don't.
A lady told me, she says, I was with my children and it was like a suggested price of like $12 or something like
yes.
that. And she gave them $1.
I mean, it's in small print. It says it's suggested.
Right. And
suggested.
And she gave them $1 and they said, but the suggested is $12. And she said, and I chose not to pay that. I'm giving you the $1. And here's $1 for my two daughters and my son.
Right.
And they're gonna want stuff when we go inside. I know.
Right.
So I'm going to be spending it. I don't have a lot of money, but I think that they need to see the museum.
Right. Right.
So it's something.
I mean, there's more valuable options instead of just taking them to the casino. You know, it's more viable options. I believe. I mean, during the summertime they have free movies in the park. On, I think there's a place on the West Side Highway. They have free movies in the park on the West Side Highway during the days. They have free movies in Bryant Park.
Except that I don't know how many senior citizens are going out there in the middle of the night. I mean, in the nighttime to watch movies.
Well, I'm just
saying.
Maybe not Bryant Park, but I know the one. I know the one on West Side. The West Side Highway would be. You know, they show good movies during the West Side Highway. There's a few other places. I don't know about South Street because now they're rebuilding South Street, so they said they're supposed to be renewing it. So, I mean, there's a lot of options in New York to do for the older crowd anyway. I
think for everybody.
Exactly.
I think for everybody.
But, you know, I mean, living in New York, it can be strange. From time to time, it could be challenging because, you know, the cost of living and the cost of buying stuff and doing things, stuff like that, and they think that's the only option to do. And I know a lot of senior citizens that don't
Because people think I have a set income,
Right.
okay, and if you get a little bit over that, then it seems like you're penalized.
Right.
Even with Medicare, if you have a certain amount of money, you don't pay everything else that everybody else pays.
Right.
They call it income related, so increase.
Right.
So even I had to pay more for my Medicare last year because, year before last, because when I ran for mayor, I took out money from my 403B.
Mm-hmm.
So they said, okay, you had all that money, and I'm saying, no, I spent that money, and they said, so you still had it, and you're going to pay this much
Right.
more.
Right.
So Miss Hazel is she's my prime example because she keeps saying, but I know somebody who just got here
Right.
and they have everything. And she said, I don't have food stamps. I don't want food stamps. She said, but I think I may be eligible for food stamps. She's not. She's $4 over. But she said, this person has not been here a year and they have Medicaid, food stamps, and I don't know how they got subsidized housing.
Wow.
Okay. So I'm like, I'm nobody, which is what, because she was calling me and telling me like I could do something about it.
Right.
And I said, I don't understand it. Maybe they were refugee because refugees are eligible for everything when they come here.
Yeah.
Okay, so maybe they're a refugee. I don't know, but I don't expect that they're going to be on the rolls forever. They're
Right.
just till they get on their feet.
Right. Right.
And she's saying, I think that they're going to be on forever because I'm still working to make sure that they stay on.
Right.
And that's how she's interpreting that. The people who work are paying for the people who didn't. And I have to, explain to her that, welfare is controversial in this country.
Right.
Because people think that there's a little bit of people who just don't do anything and will never do anything and is living off the fat of the land. Right.
Right.
Right. First of all, if welfare gives you $215 a month for rent and you live in New York City where you living, you're not even living in a closet.
That's true.
Okay. The bottom line is the welfare budget of this whole country is only 2% of aid to families with dependent children and home relief. Only 2% of the welfare budget is that.
Right.
That's it. It's aid to families with dependent children and home relief. The other 98%, they don't call it welfare, but it's still welfare.
Right.
They call it subsidies. So let's get really funky and start talking about the subsidies to communications, the subsidies to the farmers,
Right.
the subsidies to the oil companies,
Right.
the subsidies to the communications people. That's welfare. So they should call the aid to families with dependent children subsidies also. Then there is no welfare in this country. If you want to cut it off, then cut it off that way.
Right.
It's just I just have so many problems with the verbiage.
Right.
It's call it what you want to call it. I'm saying make me healthy, help me. And that's all she's saying. She's saying I'm afraid to go to the doctor because I don't know what the bill is going to be.
Right. Right. I mean, everybody wants a straightforward plan. I mean, a straightforward shot of knowing, okay, I can go to my doctor and I ain't got to worry about this or that, or having to pay for my medical bills, or having to worry about my medical bills. That's all anybody wants anyway, is to live basically point A to point B. Make it point A to point B.
Okay, because I went to urgent care,
Right.
and urgent care was paid, but they referred me to a dermatologist. So the nurse, she said, "Oh no, can you go upstairs to?" So I went upstairs and I paid that doctor. I'm getting a bill from urgent care
Wow.
that pointed me upstairs.
And he didn't do nothing.
She didn't do anything. She pointed me upstairs, and I'm saying, and the paperwork says Dr. blah, blah, blah. And I'm saying, I didn't see no Dr. blah, blah, blah.
Right.
So you're not getting my money.
Right.
And now they're sending me yellow bills. They send you white bills for 5 months, and then they send you yellow bills, and they're threatening me now.
Oh.
And I'm saying, come on with it, because we're going to talk about
$25?
Mm-hmm.
For $25?
Point me. point me to who this person is that's charging me when they already got $300 and something from Medicare.
Wow.
So why are you coming after me for $25 when I had to pay the deductible, not the deductible, the copay upstairs when I went to see the doctor that you sent me to?
Right.
And that system, and while I was there, I said, because I had written out a check, I said, well, who do I give the check to? Oh no, you have Medicare. There is no copay. Liars. No, they're mistaken. Because then you sent me a bill. Well, you told me no when I was there. Well, I'm not paying now.
Right.
You told me you refused my money.
Right. I mean, it's a major thing. It's just like I was dealing with my sleep apnea doctor. And the reason why I had to really leave him alone is because I would have to try to catch him on a Wednesday. It wasn't suited towards my needs. It was suited towards his needs, having to catch him on a Wednesday here, and he has 3 other different locations that he works at. And, the payment, trying to pay him, they didn't ask for it up front. I said, I have a co-payment. Oh, don't worry about it. You have to pay for it. You don't have to pay for nothing. I said, okay, you sure? Because my insurance is saying that I had to pay a co-payment. And I have the money on me to give it to you. Oh no, we don't need the co-payment. Everything the insurance is going to pay for. I said, all right, no problem. Then 3 months later, I get a phone call the day of the appointment that I was supposed to go in, and they say to me, oh, you can't come in because you owe us a lot of money. I said, well, how much money do I owe you? They said, I figured I would probably owe you maybe $200-300. And then she says, well, I don't know how much. So how would you not know how much I owe you, but I owe you money though? So, and it took them about a month for them to call me back just to tell me I supposedly owed them $1,000, which I didn't, which I knew I didn't. Because I said, listen, the insurance, I know the co-payments, I owe you $300, and I'm willing to give you that, but $1,000, that's unheard of. So they never got back to me. So I never heard anything from them. I've been trying to call them for the last month or so, but nothing to prevail. But, it's make it simple. Somehow it needs to be made simple for us as people with the health coverage, so that way we're able to go see our doctors and without having to have the problems that we have with our doctors, as far as payments is concerned.
I don't know. I forgot to do something. Y'all know I'm TBI, so yeah. I give all of my guests a flip-flop that lights up. I know you can't see it, but it says "In My Shoes," and this is yours.
Thank you.
Your souvenir of the show. So I didn't want to get away without saying that.
Thank you.
And it's not, see, it doesn't have high heels or anything, so. Okay, now getting back to that, I'm sorry.
All right, so, I mean, as far as just make it, somehow it needs to be made simple for us as Americans, as far as people here, to use the health coverage. So that way we won't have to go through traumatic situations with the health coverage.
But I can't. I've been trying to think about how do you centralize the information, and you can't just put it on the computers, because there's a lot of people.
Not a website. It should be, I believe it should be an office, a person that you should be able to talk to.
But if each state is different.
Right.
Each state is different. But it's federal. But is it run by the state? Yeah.
I wouldn't know if it was ran differently by state, but I know it's a federal. But different states have their own websites and different marketplaces to link up to the insurance companies that you would be able to get. But I wouldn't know if they control anything as far as law is concerned.
I'm trying to think if they have, like, you have EEO, you have affirmative action, you have Is there no healthcare office? There's no. I know you have the board at the Department of Health or Board of Health.
I would think it's Department of Health. Department of Health.
Department of Health.
Right.
Would that be the ideal place for it to be?
I believe so because they do at the Department of Health they do sign you up for Medicare and Medicaid, right? There.
I don't know.
I mean, I remember I went down to the when I went to go get my birth certificate down.
That's the Bureau of Vital Records.
Right, but there was but the health department was next
New
to
York
it,
City.
and there was a guy there standing there saying who was signing people up for Medicaid, Medicare, or Medicaid. Was signing up for both of them.
Oh, really?
That was standing next to the line, and he was saying anybody who didn't have health insurance, he was signing them up.
That may not have been for Medicaid though. That may have been because I know when I've taken Miss Hazel to the Medicaid office,
Right.
there were people outside the Medicaid office trying to sign up people for different health care carriers,
Right.
health coverage carriers.
Right,
But it wasn't necessarily Medicaid. It was all these different names of things that I think they all wanted the same, but so and she was going, I don't know what that is. I don't know what that is. I don't know what that is, and I'm saying neither do I. And we're gonna keep walking.
I mean, it's time. I mean, I think what I should have done, and I think what a lot of people should do from now on with this law in play is take the time and because I've rushed into it. I basically rushed into it. So what I'm saying is do the research first and look at the different insurance and look and find out what you're getting into. Try to talk to somebody before you go to get the insurance. Like I think the starting limit is the time that it starts. I think is in December, and it ends in this year. Ends in February the 15th.
February 15th.
So from the time that you have for open enrollment, do the research, check the insurance companies, check your policy, know your rights as far as what are you able to get or what they are supposed to do. So you won't be like me walking into a situation like I can't use my insurance until I pay the deductible down. I believe that would need to be done. That would need to be done. But it needs to have somebody there to instruct people who are not tech savvy or who's not tech savvy or don't have a phone or whatever the case may be, able to talk to them and sit down and have a conversation with them and say, okay, this is your options. This is I think this is what you need to do, and this is how much money to go through them step by step to figure it out.
I think maybe they have the big libraries now. Like there's a library on 310 East Kingsbridge Road, but they have a huge auditorium.
Right.
And they could do like just a training.
Right.
And so it doesn't have to be at the office there, but it should be on maybe quarterly.
A seminar?
Yeah.
I believe it's seminar. Yeah.
Have quarterly seminars on just the various healthcare options.
Right.
Because people don't understand that you do have options. You're not stuck with this. Nobody's making you take this.
Right.
But people are taking whatever they can take because they can take it and get it over with because I don't want to be penalized.
Right.
And I don't charge me if you don't have to charge me. So and you ended up paying more in the long run.
Than the penalty. Than the penalty itself. I mean, but that's that's certain people. That's for me. As far as me, as I can speak for me and say, yeah, I got it because I didn't want to pay the penalty. I didn't want to have to worry about the penalty, but also wanted to make sure that I can be able to go and have health insurance, so that way if something happened, I can be able to go take care of it right then and there, instead of not having the insurance and then I have to worry about this large bill that I'm gonna have to pay. So I mean, that's me. That's my opinion. But I mean, I feel do the research, check your insurance, your providers. Go to the marketplace and just check. Just look, or if find somebody that could help you do it to make sure that you don't get into a situation where you're destitute.
Okay. Well, if you've ever seen the show, you know that
Right.
I'm running over again because that's what I do.
Right.
But I want to thank you for coming and helping to share the healthcare situation. And to my audience, I want to say again, thank you for choosing In My Shoes. It's been great, and I hope to see you next time. Next week, actually. Be good.
Yeah, M-Wham got a message for you. Check it out. I've been less offended by the boxers, all the sagging pants in our community. I got a song for you. Check it out. Here we go. Come on.
Pull your pants up, pull your pants up. Pull your pants up, pull your pants up. Pull your pants up, pull your pants up.
Yeah.
It's the new style.
Come on, collect, talk to me.
Say, Mr. Harris, sagging jeans is an epidemic.
That's right.
One that I've never been a fan of. And I can't stand how these young men, they sagging, they dragging. Come on, pull your pants up. And I know us girls, we in the wrong for not putting these fellas on.
You got the power.
But I'm offended by boxers. And I think that we all should be.
Come on, help me.
Pull your pants up, pull your pants up. Pull your pants up, pull your pants up. Pull your pants up, pull your pants up.
Why?
It's the new style.
Come on.
Pull your pants up, pull your pants up.
Yeah.
Pull your pants up, pull your pants up. Pull your pants up, pull your pants up. It'll make your mama proud.
Here we go.
We living in a world affected by an epidemic. Sagging jeans and sweatpants is how I'm living. Need to set the example to make the future right. So hey, our message when we hit you with the chair, right?
Pull your pants up, pull your pants up. Pull your pants up.
It's kind of crazy.
Pull your pants up, pull your pants up. It's the new style. Pull your pants up, pull your pants up. Pull your pants up, pull your pants up. Pull your pants up, pull your pants up. It'll make your mama proud.
I know you heard your belt say. You know your belt was talking to you this morning. Said, come on, just take me with you.